In the head-to-head series, I show you two different patients with two different diseases, but similar radiologic appearances, and you see if you can make the correct diagnoses. Today's topic, an anterior third ventricle mass. Here's patient number one. I'm just going to point out the mass because it's actually kind of subtle. It's right here in the midline, there and there, and in this post-contrast image, well, it just blends right in. It's a little bit brighter than the surrounding brain parenchyma. Here are a couple more images on patient one, same patient. Here is a SAG T1 without contrast, and I didn't have a regular CT, so this image is from a CT angiogram, but you can see the mass in that location right there. Again, not that different in density from the surrounding brain. Now here's patient number two. Again, a mass in the anterior third ventricle. Here it is post-contrast, but of course you're asking yourself, is that really enhancement, or is it just bright T1 signal that is shining through? Well, here's your answer. Just to be fair, I'm going to give you a SAG T1 on this individual as well, and you can see that that's actually intrinsic T1 signal you were seeing on the post-contrast image. And here it is on CT, looking a little more dense than patient one's lesion. So here's patient one and patient two next to one another. Here's their T2 weighted images. This would be a good time to pause the video, maybe even rewind to some of the other images I showed, and see if you can figure out what the diagnosis is on each of these two patients. All righty. In each of these cases, we have a spherical or ovoid anterior third ventricle mass. So how do we tell the difference between these two lesions? Well, it might be kind of difficult on the T2 weighted sequences alone. Maybe on this one you can see a little more CSF around the periphery, and on this one it seems to adhere to the brain itself. That might be a clue, but let's look at some other images and see if we can get a more precise localization. Here's patient number one. You can see that this mass is on the lower aspect of the third ventricle. Here is the foramen of Monro. And this is not in the foramen of Monro. It's inferior to the foramen of Monro. It's actually coming off of the hypothalamus down here. In patient two, on a coronal image, this time a coronal post-con, this lesion is right smack in the foramen of Monro, in a classic location for a very specific diagnosis. Patient number one has a mass of his hypothalamus. This turned out to be a hypothalamic glioma, a low-grade glioma. That's why no enhancement. And the classic appearance of the colloid cyst centered in the foramen of Monro. I think that the trap here is to see this in this location and come to a snap judgment that this also is a colloid cyst, when in fact this patient had the colloid cyst.